the sales examination of veterinary viewpoint. I don't think I'll be quite as entertaining as Sir Mark, but we'll have a go. It's a huge subject, and it's certainly nothing we can cover in half an hour, so I'm just sort of picking little snippets of information that might be interesting and drilling down into them a little bit. Obviously, the thoroughbred sale, as Sir Mark said, there's an opportunity to sell your horse numerous times from fetus, actually, pretty much all the way through to old brood mares. And I think we'll just look at some of those as we go. So the main category, I guess, of sales is yearlings, but then we have foals, breeding stock, and each and every one of those have their own considerations, clinical approaches, and various perspectives that we need to consider. And I think it's very important at this point to actually ask ourselves what we're trying to achieve. So as a veterinary profession, what are we here for? And there are various reasons for us to be there, sometimes rather annoyingly to various stakeholders in the game. But we're not there to try and provide a guarantee. We're certainly not able to look into the crystal ball and give you some indication of whether the horse is going to stay sound or not. And I think also a critical thing to remember at the sales is we're not actually able to do a proper veterinary inspection. So there's a lot of limitations at any sales ring that you can't complete a full examination. So there's no exercise test, there's no or very little lunging, and horses are there quite often away from their home environment. So you're looking at a horse that's often quite stressed out or tired from examinations. Quite often the people handling and presenting the horses to you don't really know much about it, which ends up often being a great advantage to the seller. So we struggle, and our professional indemnity insurance team, the VDS, encourage us not to call them vettings, but to actually call them a pre-bid inspection, which is just a bit of legal thing, but it's important to recognize that they're not proper thorough vettings. So I think from our point of view, we're there. We need to try and get as much information as we can in a very short period of time. And the getting the information is relatively easy. It's how we firstly interpret that information and then communicate that to our clients. And I think that is a very common scene. As this man needs no introduction, and it's sort of, for me, he's there. The center of the sales is the sales ring, and he's conducting the show. We're in a situation, our client is there, he's got his budget, he's got money in his pocket, he wants to spend it, he wants to go, or she wants to go home with a horse. The vendors definitely want to sell the horse. They've put a lot of effort into getting the horse there, spring x-rays, preparations, lots and lots of money, maybe buying the horse. So there's a lot of stress, a lot of anxiety. Bloodstock agents, they definitely want as many things to happen as they can. And I think sometimes we're just seen as a blinking nuisance in the whole game, because we quite often end up putting a spanner in the wheel of what could be a smooth and profitable process. I think everyone's under stress at the sales. There's time scales involved. There's a lot of money involved. There's us as busy vets end up getting a big list, and we think we're under control time-wise, and all of a sudden you get one little ping on your text message with 10 more horses to vet. And so it does get stressful. And the expectations now are huge. So with ultrasound endoscopy, cardiographic assessments, radiography, and people expect instant results. So, you're quite often getting a request for a full set of x-rays as pretty much as the horse is walking up to the sales ring. And we seem to get it done, but the expectation is huge, and everyone's under pressure, and quite often relationships between vets and vendors are a little bit stressed. Absolutely critical to know the people in the industry. I think, this is, the more we as a vet team get to know you as the industry people and other vets that we work with, the easier the game gets. And I think it's all a matter of knowing people, being honest, being upfront, and communicating well, and being fair, because there's a lot of potential to get things wrong, and knowing people are very, the teams and the involvements is very important. From the vet's point of view, conflict of interest aspect is critical. So we do end up working on a number of sides of the fence inadvertently. I might look after some yearling preps as they come through, or racehorses going through to sale. And I think it's very important to try to avoid those conflicts of interest if we at all can. And when we can't, then we need to be open and declare those. And another critical aspect of vettings or examinations at the sales is to understand what you're vetting the horse for. And each category has its own considerations. So racing, both flat and national hunt, I think really what the buyers want us to try to do is basically give them some degree of risk assessment. So in order to do that, we need to stand back a little bit and say, what are the major risks of having a racehorse in training? And we all know that the things that go wrong with racehorses in training are quite, a small group create 80% of the problem, and that involves the simple things like the knees, the breathing, bleeding, other orthopedic diseases, stress fractures, injuries, but probably more importantly, absolute lack of ability. Now, some of those things we can try to predict from an examination at yearling stage. Some of them we've got no chance. We're not going to be able to tell whether the horse is going to be able to breathe properly necessarily or displace its soft palate at a later date. We're not going to be able to predict whether it's going to be a bleeder. We're not going to be able to predict whether it's going to get bone bruising and concuss its hind fetlock joint. So there's a lot of limitations, and although a horse that passes a vetting very cleanly, it doesn't necessarily transform very well into how sound and easy that horse is going to be to train. So although it's a critical thing to get done, there are a lot of limitations. National hunt horses, obviously some aspects that are more critical, the breathing and the respiratory tract function is important, tendon issues, soft tissue issues, etc. as well. So from a breeding point of view, brood mares, feet are obviously critically important, much more important than the racehorse. They have to go on through cycles on an annual basis of being in foal and potentially sick pre and post foaling, and laminitis is a major issue, so foot conformation is important. Limb conformation, if you're breeding to sell, then you certainly don't want to be breeding crooked horses. I haven't put on this slide endoscopy, but more and more people are now scoping brood mares prior to purchase. You don't want to be breeding a lot of horses with bad larynxes. Vulval conformation, obviously breeding history, if you can get that, is critically important. And fetal sexing I've put at the bottom there, which is becoming more and more common, and probably an area which is important from a sales perspective. There is no obligation for vendors to declare whether the mare has or has not been sexed. I think there's quite a bit of openness and honesty about it. A quick poll of some of the stud vets with us would indicate that between 10 and 25% of brood mares or the fetuses are sexed, and that percentage is probably a heck of a lot higher when it comes to the sales. So I think that is used commonly to try to decide whether you keep the mare or sell the mare. There have been some anecdotal stories, and I don't know how accurate these are, that some buyers coming to get a good band of brood mares, take them back to their country, fold them down in their country, have ended up having a high percentage of fillies. So maybe that was just chance, maybe not. But there's something I think we need to be aware of, and it is happening, and there's not much we can do about it, and it's there. International horses, so this probably relates more to horses in training, but and including breeze-up horses. But the Hong Kong Jockey Club tend to be a little bit of a benchmark for vettings as horses in training, and they have certain criteria, and it's getting more and more difficult now. And one of the recent introductions is the measurement of tendon size. So they have a feeling in the Jockey Club in Hong Kong that any horse measuring greater than 1.6 centimeters squared, so it's a mediumly big tendon, but it doesn't mean it's got an injured tendon. It might be a historical issue, but that can put the horse into a high-risk category. So what we don't want to do as vets is pass a horse that's got a slightly big tendon and then find that it's rejected by the Hong Kong Jockey Club. So that we need to be very aware of, and that means that if we're vetting for Hong Kong, or examining for Hong Kong at the sales, we need to be absolutely thorough in getting scans and measurements, and it just adds to the workload that's required for these examinations. Other aspects that need to be considered are vaccinations, import and export requirements, but there are a lot of other jurisdictions, not just Hong Kong, that you need to be aware of. America, for instance, with I think their scrutiny at the moment on soundness and minor changes is tuned up quite tightly, and I'm finding that any horse going into California is got very little chance of getting in unless it's absolutely perfect on x-rays. So you need to be aware of all these little nuances. With respect to the international thing, I've put this slide in here now just to sort of prompt me really to mention how much the international transfer of information is becoming a big part of vetting. So, you know, you can be examining a lot which is 30 or 40 lots away, and you're talking to a trainer, a Californian trainer. He says, oh, you couldn't just speak to my vet in California. So you speak to the vet, and he says, oh, just send me the images. So all of a sudden, you're WhatsApping photographs, you're videoing a video screen, and so it's changing. You're Dropboxing things. The vets have got access to online repositories. So the whole face of the way the world is getting smaller and smaller with respect to information, and it does take a lot of time. It takes a lot of communication, and it adds significantly to the workload and the amount of time you spend with your mobile phone stuck to your ear. But it is important. It's useful. It helps us, but it also creates a lot more work. So pinhooking, we all know about pinhooking to buy with the objective of later selling at a profit, mainly probably as foals to yearlings, also yearlings to breeze up. So if we're vetting for those, we just have to drill down a little bit tighter and make sure everything is squeaky clean. It does, from a vet's point of view, create a further potential for conflict of interest, and we're lucky enough that we've got a big enough team that if Rob and Tom, for instance, are vetting for one of the big the breeze-up consigners, then they'll just stand back if at all possible and leave those breeze-up horses to be vetted individually. Some interesting things I think about breeze-ups is that as foals and yearlings, you put a lot of emphasis on the walk and conformation. Now, if a horse is breezing well, its legs are handling well after the breeze, it's got good x-rays, the walk and the conformation might not be quite so critical. So I think that the significance of various things can change depending on the sale. Likewise, I've put there a plus or minus the larynx. We all know that at yearling stage, quite a few yearlings are returned, having gone through the process, largely because they make a noise on the lunge. Now, a lot of breeze-up horses won't make a noise in a straight line, and quite often that's a criteria. So we've all seen yearlings and know of yearlings that have failed the wind test and then go on and pass the wind test at a breeze-up. So that's just something to be aware of, and it often creates a little bit of discussion. So the scope of the examination, history is critically important, not always easy to extract thoroughly. Clinical examination, probably the cornerstone of everything, and can't be underestimated. And then it goes on. We're obviously scoping a lot of horses. Radiography, and Debbie's going to spend a lot of time going through radiography, so I won't spend much time on that. And then ultrasound we've touched on, cardiology, and sometimes even a pre-sales wind test if possible. So the history, it's quite difficult. As you can imagine, quite a few of the vendors have temporary staff in. You quite often, it's hard to get a true history from the person holding the horse. You ask them, are there any vices, surgeries, medication? You can guarantee what the answer will be. No, sir, not at all. And they've only known the horse for 2 days or 1 day. So, you know, it is a matter of knowing the person in charge, going to them and asking them. Most of the vendors now have got it well recorded, and they'll check up and give you all the details you need. But sometimes it is quite difficult. Horses in training, you can always go to the Racing Post website. That's quite useful. Horses history will also mention wind surgery and various other things. So that's a useful resource. The Testicles or other sales company resources are also quite useful to go back to. But you need to be aware of the conditions of sales for each sale. They can be different from country to country. Medications I've just mentioned here briefly, bisphosphonates and anabolic steroids. I've put in brackets Regumate and that. Now, that category of drug under the BHA rules and other rules, but they're quite significant because they can end up resulting in a significant ban, either a lifetime or a long-time ban. Regumate, I'm sure you're all aware, contains traces of an anabolic steroid, so it has to be put into that category. And I know a lot of consigners still want to use Regumate for preparation. It's a useful product, but it is banned. David, you're here. Is that okay? Thank you. So surgery, there's no need in this country to declare surgeries. In America, a certain number of surgeries will have to be declared, and you'll find reports in the repository there. Previous sales results I've mentioned, it's good information if you can get it, if you've got time, and also possible wind test results. So there will be some information come through on horses that have previously failed wind tests. This is ideally the history we'd like to get. You've got no chance of getting that at a sale. So clinical examination. I tend to try to spend 10 seconds or a bit more just standing in the stable, looking at the horse without touching it, leaning on the wall and just sort of eyeballing it. Is the horse, does it look like it's in the right sale? So the fitness side or the condition side, a horse in training, you know, if it hasn't run for a month or so and it's a big fat donkey that obviously hasn't been in training, then you start thinking, why is this horse like that? What's going on? Is the horse healthy? Temperament, general preparation of yearlings, is it underprepared? Why is it underprepared? And it's good just to take 10 seconds just to stop and think about it and just look for lumps and bumps. Quite often when you get too close to the horse, you can miss some significant parts of it. History lesson here. Bill Tutt was a man born in Michael Bell's yard, maybe not directly, but he's quite a famous Newmarket person, and he was responsible for breaking one of the codes that led to success in the World War. There's a lovely memorial set up to him at the top of town, and I love this, and I think it very well describes how we should look at the horse. If you get the angle right, you can see things. And if you get the angle wrong, you'll miss things. And I like to walk around a horse and look at it from different angles. And when you get it there, you can see Bill Tutt. And I think that is, for me, it's quite, I love to walk around a horse from every angle and try to look at every leg from different angles. And it is quite a valuable aspect of my examination. So heart, you know, from the vetting exam, we look at heart very quickly, listen to it. It's not a very thorough examination, but we look at listening quickly for rate, rhythm, murmurs. If it's anything below those three, we get a phone call quickly into Celia and she will come up. There is this feeling that a large heart is a good thing and it makes a good horse. It goes back to a lot of history. I think this horse was a famous horse, and apparently it did gallop like that and its head down low, but he was the Frankel of the time and was thought to have had a very big heart on a post-mortem examination, but he was a phenomenal racehorse. Before the advent of ultrasound, heart size was assessed using ECG, very crude and probably very inaccurate. We'll move on from that. So these slides are courtesy of Celia, and Celia has done some study on a certain population of racehorses looking at heart size, and there are various ways of doing that, but essentially you're making an assessment of the size of the left ventricle. Celia will correct me if I'm wrong here. Her study was interesting, and she looked at 219 thoroughbred yearlings and then compared her findings to their race results at the end of their 3-year-old career. She then categorized the heart size, so that's the groups along the bottom of that graph, from the smallest 10% all the way up to the largest 10%, and then compared the heart sizes to how many raced and placed and how many black type horses. So it's not quite the linear graph that you'd expect, so it certainly doesn't start rocketing up as you get a big heart. And if you look at just the black type winners, interestingly, on the 91 to 100 percentile group, they're not overly represented well. So there is some statistics to say that from this data that a small heart is disadvantageous. But I think just looking at the graph, I think it's hard really to be absolutely transfixed and say heart size really matters. But there are a lot of people still going around measuring hearts. They think they've got the magic formula. For me, I struggle to get too much enthusiasm about scoring hearts at sales. But it is happening. It's, for me, the strength of cardiology is to identify abnormal sounds, abnormal rhythms, and try to give me information that I can feed back to the clients. This is a classic atrial fibrillation where there's lots of fibrillating spikes of the atrium and then intermittent depolarization of the ventricles. So that's classic atrial fibrillation. There are other abnormalities that will be detected on an ECG examination. And also, if you get horses with loud murmurs, there's often reasons for that. Some of them are clinically significant, some of them aren't. That slide on the right there shows a septal defect with heart going through. So without ultrasound, you wouldn't have been able to identify what was causing the noise. Eyes seem to be much more important in America than here, but we don't have many eye problems, but it's part of the examination. Not unusual to see congenital cataracts in the lens, the picture on the right, or little ulcers and things on the left. It's important to do it, but very seldom does it result in major issues. We say in our examination, we look at the mouth. We probably don't thoroughly examine the mouth. We're literally splitting the lips and having a look of the incisor arcade, so it's not a proper oral examination. We very seldom would put a gag on a horse at the sales complex to properly examine the oral cavity. But we can assess certain things. The slide on the left is very worn down incisors. This horse was a cribber, so if the vendor told you it had no vices, I think you'd definitely have to go back and ask them again. Not unusual to see serious incisor defects associated with fractured jaws, etc. So I think when we say we're looking at the mouth, it's not really a thorough oral examination. Testicles, these are the lottery ticket of the thoroughbred industry. I think, if you get lucky, you buy yourself a colt that wins a Group 1 and then you can retire. So they're examined, and not unusual to see rotated testicles of little consequence, not unusual to see one testicle missing or high, not palpable. Some people don't mind rigs, others dislike them, avoid them. Surgical scars, I always make a good point of feeling and having a look underneath the midline. So this is an old colic scar. Some of the surgeons now, or some of the surgical procedures go so well that you'd never see these. So very important to have a look into that area. I'm going to touch on this, although it's not absolutely critical to this discussion. I just find it interesting. So more and more people are talking about kissing spines at the moment, and it's not so much getting into yearling exams, but horses in training is coming. And people will be looking at dorsal spinous processes. We did a very brief look at a small group of horses to see what the percentage of kissing spines was. The dark blue there, other group out of, I think we had 50 horses. The dark blue are the horses without any signs of kissing spines. So just to put it out there, it will become part of examination shortly, I'm sure of it, because it's very easy to overinterpret the significance of kissing spines or dorsal spinous process pathology, but it is common, and it is common in clinically normal horses. So when it does start coming around, it's just nice to be forewarned and forearmed with that information. Pelvic asymmetry is critically important. I like to see them stand up square. I also like to see pelvic symmetry with the horses walking away. For some reason, it's quite often not very well correlated. And for me, all you want to know is that a muscle asymmetry, so the horse on the right's definitely got a lower profile to the left side, or is it bony asymmetry? We'll often use an ultrasound assessment of the pelvis if we suspect that. This is a classic ultrasound assessment of a horse with a pelvic stress fracture, which has resulted in a drop on that affected side, and you can see the callus on the dissected out pelvis there, different horse. Feet, now some vendors and yearling consigners especially, I take my hat off to them. They seem to make horses walk and have conformation that's perfect, which 3 or 4 months later, the racehorse trainer and myself will be looking at this horse walk up and down with very crooked legs, and I'm sure you've all been in that situation. And little adjustments on the feet can make a massive difference to the way the horse presents itself at sale. And I know, Nick, you're sort of a master at some of these, getting your yearlings through and making them look good and straight, but simply lowering heels, sometimes using tapered shoes, various imbalances can make a big difference. So I make a big point of looking at and commenting on foot balance and any obvious trimming, because it does bounce back and bite you at a later date. Horses in training, we don't often do foot radiographs, but I think they're important if we have a chance to look at foot balance. The foot on the right has got a negative angle or reverse rotation where the heel part of the pedal bone is lower than the toe, combined with the radiograph on the right where there's a medial-lateral imbalance with the medial side low, quite common. That can just lead horses to a propensity to have lameness associated with the corn area, and critically important. Slide on the right is a poor photograph, but you can see a raised heel, and if you see that on hind legs, and if you're not looking for it or thinking about it, or someone's talking to you, your phone's going, it's quite easy to actually not comment on those. But you know, horses with a propensity to lock their stifles can be prevented from doing that with a simple wedged heel. So I think be aware of feet, quarter cracks, synthetic materials, broken things. They need to be commented on. They are important. Bar shoes, it needs to be thought about and mentioned. Knees for me are always very important with yearlings or horses in training. A major problem for us as vets that work on the racing side. So I do tend to tune in quite tightly into knees, and minor subtle changes I think are critically important, especially a fusion in the middle carpal joints. Very, very important, and will drive x-rays if we don't have them. Growth plates and surgical scars, also an important area to look at in the knees. Knee conformation. So, I mean, we all drill down into knee conformation. Offset knees, toe end, carpal valgus, back at the knee. I think very important. I think one of the fascinating aspects for me in the year is always transiting from yearling exams to horses in training. So you've got these yearlings, and you book one, they're beautiful, they walk straight, and then you go on to the horses in training sale, looking at the Group 1 winners and what have you, walking up and down black type horses with the most horrific knees. So there doesn't seem, it puts it all back into perspective, and I sometimes think it would be better the other way around, because I think sometimes we're overly critical, and although conformation is important, there are a lot of other aspects in play, including training, genetics, surfaces, shoeing, riding, etc. So we need to comment on it. I try not to be overly critical unless I feel that there are reasons to be, i.e. significant clinical signs or radiographic changes associated with bad conformation, but we all know there's plenty of terribly conformed horses that are winning good races. This is a little bit of radiography. It's not going to be yearling radiography, but I think the radiography, we as a veterinary profession are a lot better, but I think there's a big area for improvement. These are skyline views of the third carpal bone, and I just want to highlight a few areas that Pete and I are always banging the drum about quality, and some radiographs at the sales are excellent, some are disastrous, and we do need to be ready to retake them if possible. This is actually the same third carpal bone, one shot well, one shot badly. And actually the badly shot, if you're looking at this area through here, which is the radial facet of the third carpal bone, this area through here, they can look extremely different with badly projected views. But third carpal bone views are very important for horses in training, one of the most important views, and they need to be shot well. An unhealthy bone on the left, which is very dense and irregular in its bone density, and a healthy bone on the right, good trabecular pattern and definition between the inside and outside of the bone. Pete recently had a fantastic little publication looking at a slightly different view of the third carpal bones. And if you can see this bone here, you can make out quite a distinct line through that area of the third carpal bone, shot in a normal projection, same horse, same bone, you can't see it. So I think we as a veterinary profession, vetting horses in training, need to be aware of this, and if they're not good enough, we need to be ready and have a team ready to swing into action and get x-rays done at short notice. Still on about knees and knee angles. This is more a veterinary thing, but especially for the oblique views of the knees, you can miss pathology, or if you're of the vendor, you could hide pathology by just moving around by 5 or 10 degrees. So it is critically important to get good angles. So these are the lateral oblique views, where one image on the right here shows a very obvious bone spur in there, which in itself isn't a problem, but it just would highlight aspects that might be, and the view next to it is probably acceptable. We do get, frustratingly still, some very bad x-rays and bad positioned images, and I think, this is my chance to just keep pushing the message out that radiographic quality is a lot big room for improvement. So this is a medial oblique view of the knee shot far too dorsally, so far too in front, and that's an example of one that's acceptable, where you can make proper assessment of the margins of the joints. So it's clever surgeons now doing some clever work with straightening horses' legs, and more screws are going in for a short period of time at yearling growing stage, which is great, but it is affecting it, and we need to interpret it. These screws go in, they come out. There's often no evidence left there. They don't need to be declared, but it is important. Sometimes they will leave a fasciitis and a very bulbous knee. Sometimes there's nothing to see. Commonly, when a screw has been in and out, there will just be a little buttressy feeling to the growth plate, and it might give you a reason to go and have a better look beneath the hairline to see if there's any scarring from where the screw is replaced. But I think we need to be aware that's happening a lot, and it's doing a good job. It's incredible how a short period of time the screws into a crooked leg can change it. So fetlock joints, horses in training, critically important. I think for me, interestingly, at yearling stage, is quite often horses with very reduced flexion. They don't seem to be painful. I don't really know what to make of that. It's an interesting finding. I don't think it correlates with future soundness. Horses in training, you will definitely get some horses with marked pain response to forced flexion of the fetlock, very important. And the dorsal pouches, like these images here, quite swollen. If you see that thing without radiographs, it needs to be imaged. Heat and pulse, etc., critically important. Still on the subject of banging drums with radiographs, these images were kindly provided by Pete, but the flexed dorsopalmar or plantar dorsal views of the fetlock joints are very important. And if not present in a set of radiographs for horses in training, they need to be taken, and these will show little fracture lines, and you can see in each one of those images pathology at the bottom of the cannon with normal views or poorly taken flexed views. You'd miss those. These horses could go on the next day and fracture a cannon. So I think, I can't overestimate how important that is to get good views of those fetlocks. Also, the flexed views can highlight these lesions. So this is a horse with end-stage bone bruising where the cartilage has collapsed and it's got these big ulcers at the bottom of the bone, and you can see evidence of that on that view, which isn't projecting very well, but with these dark areas there, so that corresponds to these holes in the bone. So without those flexed views, you wouldn't see any evidence of those kind of lesions. So soft tissues, tendons, you certainly can get holes in tendons without there being any clinical evidence of it. So I think ultrasonography of the tendons is important if it's a big sale for horses in training. Be aware also that a lot of horses at the sales, whether you like it or not, are going to be treated with corticosteroids, anti-inflammatories. Just on an international thing, I came across this BBD product a few years ago, and I was examining horses in Lexington. And I got there early. I was very keen, just arrived, and I thought, this is great. And got in early, and the yard wasn't properly set up, and one of the sort of yardman was holding a horse for me, and had a dribble of blood down the neck, and I didn't say anything. And I went to the next one, and there's another dribble of blood down the neck. And I said to the chap, I said, what's this? And he says, BBD. I said, oh, okay, great, good to know. Anyway, later on, I spoke to my very good friend, Scott, and I said, Scott, what's BBD, And he says, well, it's butanediene and dex. So they fill the syringe with butanediene and dex, and so, it happens, and you need to be aware it happens. So these horses that we're examining at some places are on a good cocktail of anti-inflammatories. I don't know if it still happens, it probably does. Yeah. So, when you're at Keeneland, you have to almost assume that every horse you're looking at Keeneland is on anti-inflammatories. And likewise, horses in training and breeze-up horses may well need some pharmacological support. And although they're going to be said there's no medication, there's a lot of work goes on, whether it's topical, icing, bandaging, to produce these horses as tight and tidy as you can. Juvenile tendinitis is quite a common finding, and I've just put this up. This is an inflammatory condition of the tendon that is often flagged up, so a general thickened tendon. It doesn't mean the horse has got a tendon injury or is going to get a tendon injury, but it does indicate that a horse will need some time. That's just a graph tabulating the difference in size between left and right tendons. Often the profile is straight, just the whole tendon is thickened. They will need some time for that to settle down and probably a few episodes of rescanning. Debbie's going to touch a little bit more on this subject later, but this is an area that's critically important, is the area of the suspensory branches. I'm sure people out there producing yearlings have all produced horses with these sort of issues, and your heart sinks when you feel or see some swelling to the suspensory branch. So careful clinical examination, as per the right slide, where you can slide down and see some thickening. Radiographs, you'll see evidence, sometimes significant changes radiographically, and on ultrasound, you've got this dark area in here, which represents a strain. And the three of those tend to go together. We did a little study here on 60 thoroughbreds that were clinically normal, and we scanned all of their front suspensory branches and found that 6.7 or 7% of those had significant lesions or changes in the suspensory branches. So they do occur in clinically normal horses, in training. There's been some good work done by McClellan and Pleven, and finding a similar sort of thing, that there is a strong relationship. If a horse has got sesamoiditis or possibly significant sesamoiditis, that horse will have 5 times more likely a chance of having a lesion or an abnormality in the suspensory branch. And then going on further, if the horse has bad sesamoid and bad suspensory branch, it's got 11 times more chance of that having a problem or clinical problem in training. If they do have a clinical problem in training, they're probably less likely to start than their cohorts as 2 and 3, and they'll probably have a delayed start. So my interpretation of suspensory branch findings at yearling sales is that they're not a disaster. They are there. They more than likely will run, but you need to budget that the horse will probably at some stage have an active change, or has got a good chance of having active change. You'll have to back off it. It'll lose some time. And that study in America showed that these horses started 113 days later, which is fair. There are various approaches to how these things should be managed clinically, but that's another subject. Finally, we'll move quickly on to endoscopy. What can we assess? What does it mean? What can't we assess? And what about foals? Probably what can't we assess is the bigger part than what can we assess. So we can simply, when we are grading a throat, so we're all familiar with vets grading throats, we give you a number 1 to 5, or, they're divided various ways. And we're simply assessing the laryngeal function. There are so many other aspects of the upper respiratory tract that are critically important that we can't assess, we can't predict. So a grade 1 throat doesn't really correlate well to a grade 1 breathing horse as a racehorse. These images here are just still pictures of a very good throat at rest and a very bad throat at rest to the right. They're very black and white. It's the one in the middle that creates a problem. It's that 2B throat. You get him to swallow and he opens up well. What does that really mean? So in all honesty, it's quite hard to predict what it means in those grey areas. So we need to try and drill down a little bit more. This is a little study by Perkins and friends. This just showed that actually between experienced vets, the intra and inter-observer reliability is good. So if we're a group of experienced vets and I go and examine the horse, the same horse on the same day, I'll probably give it the same score. Or if my very good friend Duncan does the same thing, he'll probably agree with me. So whereas there is actually more variation between horses on a day-to-day basis, and that's probably not surprising, but also during the day, I think, and I think as vendors, you quite right, I think, to try and get most of your scoping done early in the morning rather than late in the morning. I think it's not a bad idea, and certainly later in the day when the horses are very tired or maybe had a drop of that yellow stuff to make them quiet through the ring, I think it does make a difference. So that's studies sort of underpinning our feelings there. A few examples. So for the vets in the room, this is very obvious. It's an entrapped epiglottis. So the epiglottis is sitting underneath here. There's a fold of tissue wrapping it up. Not an uncommon finding in horses in training. We'd see them once or twice a year just in routine scopes. And they carry a good prognosis, easily treated, and tend to do okay. You've probably all heard about these conditions, which is medial deviation of the epiglottic fold. So these tissues in here, this is taken at exercise, not at rest. We can't predict this at the sales exam. There's no way we can give you an indication whether this horse is going to have this. These horses tend to be quite noisy. It's not overly negative on a horse's athletic ability, but it can reduce it a little bit. Interestingly, also, this horse you see up the top here, those two cartilages should be meeting crisp and cleanly. There is some VLAC or ventral luxation of the arytenoid, apex of the arytenoid cartilage. So that's an interesting case. This case is similar, but no luxation there, but interesting, these vocal cords are starting to fold in, so more significant. Once again, we've got no chance of predicting that at the sales, a very significant issue, quite likely performance limiting, but we can't tell you about that at the sales. Dorsal displacement of the soft palate, there's no way that we can predict that. There's not a correlation between what we see at rest and whether they're going to displace the soft palate. There are some studies, I think Scott Pearce has done some nice work on epiglottic size, but it's still not going to give us a great indication whether that horse is going to displace its soft palate in full work. And this is a dynamic overground scope of a horse, literally showing what happens. Normal throat there, nice and open, you live with that. And as it gets tired, there's this big flap of tissue obscuring our view, flapping up and down during exercise, causing a significant problem. And this is probably our most significant, clinically significant problem with young racehorses is dorsal displacement of the soft palate. There are surgical procedures to correct that. Some horses will grow out of it between 2 and 3 as they get fitter and stronger through the airways. It's flipped back to normal and then gone again. And you can just imagine that flapping noise like a sail in the wind there, producing a right racket and significant interference in the flow of air. Less easy to predict in a dynamic scope and impossible again to predict at rest is palatal instability, which probably leads to dorsal displacement. But you can see there the epiglottis is pretty much sinking into the roof of the soft palate. And quite commonly after that, you'll get some displacement. No prizes for guessing this. This is a larynx that looks atrocious at exercise here. Now, we had one just a couple of days ago that at rest could be made to look normal, and at exercise was looking like this. So once again, resting endoscopy a good resting scope doesn't mean a horse can be good, but you've got significant restriction to the airway available because of this paralyzed larynx, and that is requiring some serious surgery. Just a Hob day itself wouldn't be enough for that. And I think that brings me to the end of my presentation, so thank you very much.